What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keone Tita. Keone, how are you today?
Good. Thanks, everybody, for listening. Today, we want to talk about a very common ailment that's out there that I see actually quite a lot of. There's not a really good way to treat it from a conventional standpoint, and that is a disorder called xerostomia. Zero meaning dry, stomia meaning mouth, so dry mouth. And dry mouth is very, very common, especially in the elderly for a variety of reasons, but it's also very common from like side effects of medications and certain surgical procedures and stuff. So I want to talk about that because there's a lot that you can do from a kind of like a holistic natural perspective that can certainly help with that.
Okay, so you see a lot of patients with this being one of their primary complaints, Keone?
Yeah, and one of the reasons I do is because I'm part of a study, a nationwide study actually, that is looking at acupuncture to treat dry mouth.
Wow.
So, and it's really interesting because it seems to be one of the few things that actually works. But of course, more studies needed. Hence, that's why we're doing this study.
Okay. Yeah.
So I get quite a bit of referrals.
That's interesting because initially when we talked about doing this topic, it's like for me, I was like, I don't know, man, just drink more water, I guess. But I guess it's not that simple, huh? You're about to educate me.
It's not that simple, but certainly drinking more water can help. That's for sure. Especially in the elderly, you see a lot of people that just don't drink enough for a variety of reasons. They just don't have that thirst mechanism that's telling them to drink as much. And then, a lot of people are worried about drinking so much that they're up all night urinating.
Right.
So.
Yeah. There's plenty of technology things. I don't know if you know about these, but like there's like new water bottles that like light up every X amount of minutes to remind you to drink and things like that, and apps and sort of stuff.
Yeah. Yeah. I'm not familiar with those. That's great. That's
Yeah.
great. I should start telling my patients about using those. Because really a lot of them just need a reminder,
Yeah.
One of the things I do is just say, carry around water with you. But again, having a reminder will help. That's great.
Yeah, that water bottle would be great for them. Because I'm sitting there getting tutored one time in PT school, and the person's water bottle starts flickering. I was like, all right. She's like, yeah, it's time to drink water. I haven't had it in X amount of minutes. And it's like, oh, that's a unique way to keep track of it.
Yeah. Well, anyway, like I said, it's more common in elderly people, but it's also very common in people on medications, and also the elderly tend to be on tons of medications.
Mm-hmm.
Gosh, I think the average amount of medications people on over 50, I think it's upwards of like 10 different medications, prescriptions and over-the-counter medications included, which is crazy.
Yeah.
And 9 times out of 10, some of those are going to be contributing to the problem. Yeah. So some of these, that's crazy. But some of these medications include like depression medications, anxiety, medications for pain, certainly medications for allergies, right? Think about decongestants, antihistamines, diuretics, medication for hypertension, asthma, bronchodilators, certain Parkinson's disease medications. So the medications just, it runs the gamut, and, you just have to look at the side effects, and most of them are going to pretty much say that may be a side effect causing dry mouth. And
will the drug call it dry mouth? Like, will it be side effects dry mouth, or is it going to tell you that the side effect is xerostomia?
Probably xerostomia. Well, yeah, it probably xerostomia. I'm not sure. I've seen xerostomia. I've seen dry mouth. I've seen both.
Okay.
If it's a well-known side effect, it will probably use layman's terms.
Mm-hmm.
There's lots of diseases out there. One of the main ones is Sjogren's syndrome, right? This is an autoimmune disease. It just causes dryness in a lot of the tissues, especially the mouth. Alzheimer's disease, diabetes, anemia, cystic fibrosis. There's a number of diseases that may contribute to this. And then part of the reason why we're doing this study is one of the side effects of having throat and mouth cancer, right? When you use radiation
Mm.
In certain chemotherapeutic drugs, what you're doing is you have to irradiate the area of the body that has a lot of your salivary glands, right? So think about the radiation coming in at the side to get to the cancer in the throat and stuff. It will, it destroys the salivary glands. So what we're doing is we're actually treating, to get into the study, you had to have a history of throat cancer and had radiation and, have dry mouth from that.
Okay.
So radiation to the head and neck is a big contributor to this. And the other thing that can do is it also can cause, not only destroy the salivary glands, but also cause nerve damage, which, to the salivary glands, which also contributes to that. And then you brought up the main thing, like for most common people, dry mouth is caused, most common thing is dehydration, like you were saying, drink more water.
Yeah.
And with that being said, there's other common things, right? Like what causes dehydration, sweating, vomiting, that type of thing can also contribute to it. And then of course, any surgical removal of those glands can certainly cause that.
So first, make sure you're drinking enough water, and then check your medications, and then your past medical history. It sounds like.
Yeah. Yep. And really, about 50% of the time, that may do it. Just doing that, and especially with the medications, and talking to your doctor about that, and just switching around some or eliminating some. Even using some. There's medications out there called saliagogues, which are medications that can increase saliva. Mm. We'll talk about that in just a second. But why would it be important to maintain your salivary output in your mouth? Well, one of the things that saliva does is it is antibacterial, so it helps protect your gums. It helps protect your teeth. And so when low levels are secreted, you're going to have high risk of periodontal disease and cavities. So a lot of dentists will see this. They'll see like, somebody have a good clean bill of oral health, and then they come in and they start seeing all these cavities. This may be one of the reasons. And a lot of times people don't realize it because it may be at such a low level.
Yeah, that's interesting. I think a lot about like my peers or whatever who could be on like ADHD medication or something like that makes your mouth really dry, and just thinking about them with that.
Yep. So, and over time, it has a pretty quick effect, causing problems in the mouth. So that's why it's a big problem. It's a big deal to make sure you're taking care of it. Mm-hmm. The other thing it will do, right? So not only is it antibacterial, but it's also antifungal. Saliva keeps the mouth healthy. And so if you start seeing patches of, candidiasis, or like these white patches in the mouth, which is what that's indicating, that's shown that you have a fungal infection, and it may be due to dry mouth. And then the other thing is you'll also see the enamel of the tooth start wearing away. Because the saliva acts like a buffering agent to acids in foods that you eat. So if you're constantly drinking, lemon water, or kombucha, and to try to make your mouth wet, that may be contributing to the problem. So hence that may be something to say, about alkaline water, right?
Right.
Certainly help prevent that.
So there's definitely certain things that you would drink that would not aid in you being more hydrated or having more saliva.
Right. Like, and just regular water, alkaline water would definitely seem to benefit, anything that has acidity to it, can just contribute to like the erosion of enamel over time. And that's especially, you don't have to worry about this if you have good salivary production, but if you don't, it can really contribute. Well, and unfortunately, one of the natural things to help produce saliva is acidic tasting stuff, right? Think about sour stuff, right? Mm-hmm. That, just thinking about it almost gets the saliva flowing in a little bit. So, sucking on a lemon or something like that. So anything that's acidic can help produce more, but it also may, help degrade the enamel a little bit. So that would be things like some, like from a natural perspective, prescribing like ascorbic acid or vitamin C, again, that would help produce, but it may degrade the enamel.
So will it degrade? Like if you took a vitamin C supplement, would it still have that effect on the enamel, or probably
No,
not because it's not?
probably
Yeah,
not. I mean, if you're drinking it and washing your teeth in an acidic solution day in and
that
day
right.
out, then it will. But
Okay.
if you're just swallowing like a vitamin C tab, you're not gonna have a problem with
It's
that.
the acidity coming in contact with your teeth. It's not necessarily the product,
Right,
the acidic product being in your body.
right, right. So from a conventional perspective, there are some drugs that they don't work well. Hence, that's why there's this nationwide study using acupuncture. But they're sympathomimetic drugs, and one of the main ones is a drug called pilocarpine, and that can produce saliva. But there's lots of side effects with that med, and it's just, for some people with certain disorders or illnesses, it's just not. It's just not useful.
All I can picture is like my Great Dane after drinking a bunch of water on these saliva producing medication.
Yeah. That's exactly right. Probably one of the best ways to do it is chewing gum, right?
Okay.
So if you have any salivary gland function left, and most people actually do, because you have salivary glands that are kind of like all over your mouth in different locations.
Mm-hmm.
So usually there's some that are functioning fine, especially if you've had radiation to the throat or neck. But chewing gum can certainly stimulate those glands. So you can just think about it as kind of like a mechanical action, like pumping these salivary glands for all they're worth every time you chew.
So really just the mechanical act of chewing
can increase. Yeah.
Okay.
And I really like using chewing gum, and I really like using xylitol based chewing gum, because xylitol based chewing gum, it doesn't have the sugar in it that can contribute to cavities, and xylitol has been shown to help prevent cavities, and it has a nice sweet taste to it. And xylitol chewing gum, I don't know, you can find them anywhere, like health food stores, even over the counter a lot of times, and that should have a preventive effect on keeping your mouth healthy.
Okay, awesome.
So chewing gum is a great one. There's a number of herbs out there that act as saliagogues or help produce saliva. This is just something you'd have to talk to your naturopath about, or whatever. You can get tinctures of these herbs. Ginger is probably being one of the most common one that can help, but there's a number of them, like prickly ash, blue flag, cayenne pepper is another one. There's a whole host of them out there.
And all of those really speak to the like the acidic or stringent kind of nature of like a lemon or something like that you were talking about, that will naturally increase your salivary, like the ginger to some degree. Mm-hmm.
So if you have something that's strong tasting too, you stimulate those taste receptors. A lot of times that will stimulate production. So a lot of these herbs do that. Let's see. What I see mostly with my clients, they'll come in and they'll start complaining of like just dry eyes, maybe indicative of also having dry mouth. But they may complain about like soreness of the tongue, where the tongue feels a little raw. They may complain about, if I'm chewing something, it feels like the food just like sticks to my teeth and everything. That's a sign, symptom of dry mouth, dry, cracked lips, that type of thing. Constantly being thirsty, difficulty swallowing. It changes in voice when speaking. These are all can be signs of that, and they also can be signs of like an autoimmune disease, like Sjogren's, that type of thing. But these are all things that would just clue you in that dry mouth may be an issue.
No, is typically bad breath going to accompany this?
It certainly would. Yep. Yes, it would. That would be another one. They just feel like, think about trying to, eat food without saliva and think about that just being like trying to swallow like a really viscous thing that, and it can be difficult to swallow.
Yeah, geez, that sounds like what they do to prisoners in Guantanamo Bay. There's no saliva, swallow this.
Yeah.
Eat
And,
this
and,
cereal.
and there's a choking risk to that too,
Yeah,
right?
absolutely.
So there's other things, lifestyle things that can contribute, and like certainly think about astringent things like coffee or how about black tea? Black tea is very astringent. Like a lot of times people drink like strong black tea and their mouth can get dry. That can certainly contribute. Smoking definitely contributes. And then any like high sugary foods will definitely contribute to that. That's why one of the things that I'll say is, we talked about chewing gum, but sucking on candy that's sweetened with xylitol can certainly help, and you want it to be sugarless. So xylitol, it's not a sugar, it's a sugar alcohol, but candy with sugar in it can contribute to dry mouth. And I see a lot of people trying to treat their dry mouth with candy, which,
Wow.
think about what that can do as far as like cavities and things like that.
So are most of the patients that you're seeing for this Q&A coming in because, like you mentioned with the study, these people have to have, they had to go through some form of radiation or chemotherapy or have a need to have this, or basically the dry mouth came secondary to whatever they had previously. Is that most of the people you're seeing for this?
Yes, so it's usually secondary to radiation treatment to the throat or mouth. But I also have people that come in that that's the main reason why they're coming in, because they read on the internet that acupuncture can really help with that.
But those people as well are coming in because of a secondary reason as to why they have dry mouth. Like the dry mouth, they're coming to see you, but it became from something. It's not just
usually so.
Okay.
Yep.
Okay. So then is there?
But there can be, let me just say this, there can be no known reason. Like sometimes it's hard to find the reason of why they have it.
Mm-hmm. Okay. So then for someone in that situation, are they typically, and I get that this may be a hard question to answer, but are they losing the water? Like is dry mouth what they're going to notice first, or would they notice like a lack of water in other places, if that makes sense? Like an inability to cry, or like difficulty urinating, or just not urinating frequently? Or like, is the mouth one of those first places where they kind of notice that dehydration or that dryness?
I would, what? It's funny because there are people where there's actually a test for dry mouth. Like they'll actually test to see how much saliva you can produce, because there are some people who don't actually will not say, my mouth is dry. They may talk about some signs and symptoms of it, but they'll be like, yeah, my mouth, I don't really have a problem with saliva production. So for most people, it's secondary. You're right. So it may be like some type of autoimmune component. It may be like I see it in a number like HIV/AIDS. You may see it there. Certainly age is a factor too. Age certainly plays a factor, but it can be secondary. Like they just don't know. They don't know how to convey what's going on.
Okay. Yeah.
Like I had like just the other day, I had this one woman who she's certainly not part of the study, but she's going, yeah, my mouth, she said, not my mouth is dry, but she says, every time I eat, it just feels like, it's just getting stuck in my gums. I just, I don't know what that's about. I'm like, well, do you think you're producing enough saliva? Oh yeah, that's not a problem, but really that's usually a sign of dry mouth. And with treatment, with the acupuncture and some of the things we went over, it's really helped, and she's not having that as much.
Yeah, and I can imagine many people aren't thinking about their saliva production.
Right.
And saliva production's great today.
Yeah, right. And elderly people aren't really thinking about drinking water either. For the most part.
Get your grandma to light up water bottle.
Yeah. And I keep bringing, that's right. And I keep bringing up elderly people, but also in younger people too, but just think about things that can help produce, help create wetness in the body. So from a Chinese perspective, yin tonifying foods, things that produce, yin is the water aspect, whereas yang is the fire aspect. So anything that is yin tonifying will help. So think about the wetness of a cold cucumber. That is probably going to help.
Okay.
Watermelon is probably gonna help. How about turning off your dehumidifier, right? How about getting a humidifier in the room? That will help.
Can I get a yang?
Huh?
Can I get the flip side, the yang, right? Yin and yang.
Yeah. So things that are not going to help are yang lifestyle things. That's smoking. Smoking creates a lot of fire. Alcohol, sugar is very yang. What else would do that?
That works. That was a few examples.
Yeah. I mean, anything that can contribute to, just not. How about eating without, just eating and drinking like a mucus forming type drink, like milk. That may over time, cause problems.
Okay. Is mucus buildup associated with?
That's how it can be. Yes. You can think about mucus buildup as being a problem. And in fact, I have a lot of people that come in describing it that way. I just have a lot of mucus in my mouth.
That's interesting, because that's what I thought about when you mentioned that smoking can cause this. It's like, all right, I can easily see how smoking would cause that. But then I also know that smoking, a lot of the problem people have is like an obstructive pulmonary disorder or something like that, where it's a lot more mucus buildup and loss of like the elastic recoil of those lungs. So I see so then you have that flip side where it's like, well, you're going to build up a lot more mucus. And then what you're saying there is those two may go hand in hand, the dry mouth and the mucus buildup.
And certainly people will describe it still, may not even say dry mouth. They'll just say, I have a lot of mucus. And I'm like, well, are you coughing up anything? No, not really. It's just mucus. I don't know where it's coming from, that type of thing.
And if you're coughing up something that is kind of, what's that question tell you?
What do you mean?
Like, are you coughing up something? One of the first questions.
So I just think that, that there may be, it tells me two things. There may be something else going on. Like they may have just a lung infection, or let's say they had, let's say they've had bronchitis or asthma or something like that, and they're being treated with medications all the time. Then I'm thinking, okay, well, maybe it's the medications like antihistamines, bronchodilators, that type of thing, which all can contribute, and they're known to contribute to that.
Okay.
So just real quick, the natural treatments that I use, I go down a checklist pretty much. The first one, like you said, drink plenty of water, sip water throughout the day, avoid certain medications. The big ones are like antihistamines, blood pressure medications, and bronchodilators. Those are big ones. Some types of hormonal medications certainly can do that. I'd say close to 80-90% of cases of dry mouth, it's medication related. Okay, especially in elderly people. Kick the dehydrating habits, right? Avoid caffeine or black teas. Caffeine certainly contributes. Limit alcohol, stop smoking, and stop the sugar. Things that can help are like sucking on sugarless candy, especially, or chewing gum with xylitol-based gums. And the act of chewing definitely stimulates salivary production. There are certain things out there on the internet that, like products, I don't know any names, but you can just Google, like Xerostomia chews or candies or things like that are specifically designed to help stimulate salivary production.
Okay.
But I just use the xylitol-based gums and candies. You really have to be, as dry mouth is a big issue, you really have to be very good about your oral care, right? So more so than most of us, you have to use mouth rinses, floss your teeth, that type of thing, just to prevent the cavities. And these things can come on really quickly, within 6 months to a year of seeing your dentist.
Okay. While we're on the topic, Keone, very quickly, Listerine as like an overall product, should people be seeking another alternative?
I think Listerine definitely has some antimicrobial effects to it. I also heard some of my patients say that it helped dries their mouth out. So I will refer them to the natural oral rinses, the ones that have xylitol in them.
Okay.
and ones that are not alcohol based.
Okay. So you would not do an alcohol based one?
No, because alcohol can contribute.
Okay.
It certainly can contribute. This is a big one. We talked about this on a previous podcast, but mouth breathing as opposed to nose breathing, right? So if you're mouth breathing, that's going to contribite. And a lot of people mouth breathe unconsciously. So just getting people to breathe through their noses, get a humidifier. The herbal remedies that I use the most, and you can think about these, a lot of these as being like very yin tonifying. Aloe vera, right? Has kind of a wetness nature to it. Of course, I use ginger quite a bit. Marshmallow root, I use that a lot. Those are the main ones. And then the other ones there that naturopaths may use is or herbalists would use is hollyhock root, nopal cactus, and like sweet pepper. What else? And then the main thing, which we see in our treatment, is that I see every day, and it works usually within 3 treatments, is doing acupuncture if you're using the right points to stimulate salivary production.
So you use it usually in the face or the head and neck?
One of the main points for salivary production is right here.
Okay.
You'll take the needle and run it like this until they feel it. It just goes about 1 centimeter or so. That's one of the main points, but there's actually some ear points. There's actually some points on your fingers. There's a lot of yin tonifying points that are down by your ankles, but this is the main point for it.
Okay.
So I guess that's it. Is there anything else? Did we hit everything we wanted to?
You hit everything I know about. I started with drink water.
Okay.
So that's, yeah.
Yeah, I mean, that's pretty much it. I just want people to know. I mean, I'm glad we did this one because I see it a lot just because I get referrals for it a lot. And
and you definitely see a lot in just physical therapy, especially like you've mentioned, the older population coming in and starting to work out for the first time in quite a while. And you often will hear that.
Yeah.
So maybe incorporating one of those xylitol-based gums or something like that could help pre-session, like pre-physical therapy session with that.
Absolutely. It's certainly not going to hurt.
Yeah.
So.
Anything else, CUNY? Pretty expensive. And
I think that's it.
We go over the order of operations just really quick, which was drink water. And then from there, you suggest the person investigate.
Well, so I think the main thing is drink plenty of water. Definitely check out your medications. Talk to your doctor about this. Possibly there are some medications that can help, but most medications make it worse. Kick the dehydrating habits, caffeine, alcohol, stop smoking, eliminate the sugar. Chewing gum, xylitol-based chewing gum or candies can certainly help. Definitely make sure you're being really good with your oral care. And use alcohol-free mouthwashes. Those seem to be much better than the ones with alcohol. Sometimes breathing through your nose. These are very simple things. Breathing through your nose instead of your mouth can certainly help. Maybe get a humidifier in your bedroom. That certainly can help too. And then there's a number of herbal remedies. Acupuncture can certainly help. But really, the main thing is stay hydrated and use that mechanical action of chewing to help.
Awesome. All right. Well, thank you everybody for joining us this week. We look forward to talking with you next week.
Yep. Take care, everybody.
Bye.